Welcome to Module 2.6, where we explore the unique ethical considerations in public health research. While public health research shares many ethical principles with clinical research, it also presents distinct challenges related to its population focus and broader societal implications. In this module, we'll examine the differences between public health and clinical ethics, discuss ethical considerations in community-based research, and explore ethical issues related to public health data. Understanding these unique aspects is essential for conducting responsible public health research. Public health ethics differs from clinical ethics in several important ways. Most fundamentally, public health research has a population focus rather than an individual focus, examining patterns and determinants of health across groups. It emphasizes prevention of disease rather than treatment of existing conditions. Public health research often has direct policy implications, potentially influencing regulations or resource allocations that affect entire communities. This broader impact necessitates robust community engagement throughout the research process. Perhaps most challenging is the need to balance common good against individual rights. Weighing population benefits against potential limitations on individual autonomy, these tensions require careful ethical deliberation throughout the research process. Community-based research approaches present specific ethical considerations. Respectful community engagement requires researchers to approach communities as partners rather than subjects, acknowledging their expertise and priorities. Shared decision-making means involving community members in research design, implementation, and dissemination. Cultural sensitivity demands awareness of and respect for community values, traditions, and communication styles. Benefit sharing ensures research outcomes provide tangible advantages to participating communities, not just to researchers or broader society. Finally, sustainable relationships focus on long-term engagement rather than extractive project-based interactions. These approaches help address historical power imbalances and build trust between researchers and communities. The use of data in public health research raises several ethical issues. Secondary data use considerations arise when researchers utilize existing data sets for purposes beyond their original collection. Privacy concerns become complex in large data sets where traditional de-identification may be insufficient to prevent re-identification. Data sharing and access policies must balance the scientific benefits of openness with protection of sensitive information. Surveillance ethics addresses when monitoring of health conditions is justified and what protections should be in place. Finally, responsible reporting of public health findings requires considering potential stigmatization of communities and unintended consequences of how data are presented. As public health increasingly utilizes big data and advanced analytics, these ethical considerations become increasingly important.